talk about what the precautions and side effects are for NSAIDs. So, in general, they are less than what we find with steroids, the other anti-inflammatories we've been talking about. The classic adverse effects are gastric ulceration. So, I talked about how um, COX-1 inhibition um, will then prevent some of the prostaglandins that are good prostaglandins from being produced and protecting the stomach. So, what happens is that we get initially gastritis. The animal will experience a stomach ache, basically. There may be vomiting, there may be diarrhea. If it goes on for a while, we can progress to gastric ulceration. That's what these little um, kind of blood clotty patches are in the lining of the stomach here. And they can go all the way through in the worst case and perforate the stomach. But typically, what happens is owners will bring their animals in before then because of the vomiting or diarrhea. And the other thing that will happen if the ulcers go on for a long time, it will produce something called melena, which hopefully you've heard that term before. It is basically dark, tarry stools, and that comes from bleeding in the GI tract far up. And and so there's a lot of time for that blood to change from being red to being this black tarry stuff that then exits the body. So there's gastric ulceration with especially with long-term administration of these drugs. And then the second thing is renal papillary necrosis. So what is that? Um, that is the part that I talked about renal blood flow in the previous section. And the prostaglandins that are produced can have an effect on blood flow to the kidney. How this happens is when an animal has an event that lowers the blood pressure, the um, sympathetic nervous system, sympathetic branch of the autonomic nervous system, takes over and says, we need to have our blood pressure up. The sympathetic nervous system, you may remember, is our fight or flight system. In this case, we're not really getting ready to fight or flee, but the body still wants a certain blood pressure. We need to get the blood around to our body. And what it does is it's the same mechanism, I guess is what I want to say, as in when you have to run away or fight. And so um, the idea is that the blood flow will be shunted away from unnecessary areas, and then it will go preferentially to the brain and to the organs of the body. But the kidney is not considered in this scenario as a an organ that we need to have the blood flow to. So we want to get that blood pressure up because also the kidneys are our organ of elimination, right? So we're going to keep that fluid in the body. That fluid will keep our blood pressure up. So, some things that cause an animal to have low blood pressure are a heart that is not pumping effectively, a hemorrhaging, so bleeding a lot to the outside of the body, not gastric ulceration in particular, and then also an animal under anesthesia. The anesthetic drugs do a very good job of lowering blood pressure. It's something that we have to monitor when they're under anesthesia. So, for a lot of these reasons, we would want to make sure that the blood pressure is maintained. And if we're giving these types of drugs around anesthetic event, we want to make sure that the animal we keep up their hydration and keep their blood pressure up. What happens is that as what that afferent artery that goes to the kidney renal artery, it gets constricted so that there's less blood flow into the kidneys. But the prostaglandins that are produced with inflammation will help to maintain some of that blood flow to the kidney. It kind of moderates that. So if we inhibit it, it makes the constriction even more so in an event where an animal is experiencing low blood pressure. So what can happen is because the papilla, which leads to the renal pelvis, which is where the ureter then exits from the kidney and goes to the urinary bladder, that area is not well perfused with blood anyway. So if there's less blood flow to it, in this kind of event, we can get this necrotic event. We get hypoxia, where we don't have a lot of oxygen coming in because it's not well perfused, and then the tissues start dying off, and that is necrosis. So we want to be careful in animals that have compromise to the kidney to begin with to not cause further compromise. If an animal, let's say the owner forgets to fill the water bowl and gives them some Rimadyl for their arthritis, that can lead to this kind of event. So we need to be very careful with that. So these are the main two. I want to emphasize that. These are the main two adverse reactions that occur with the administration of NSAIDs: gastric effects, GI effects, and the renal papillary necrosis. A third one, and this doesn't occur quite as often, but it is something that we need to be aware of. It is idiosyncratic hepatotoxicity. That's quite a mouthful. So, what do we mean by that? Hepatotoxicity, hopefully, you've identified that we're talking about the liver in this situation. And idiosyncratic is a word that means we don't know why, basically. And for some reason, some dogs are susceptible to having elevated liver enzymes due to this hepatotoxicity. And we can't tell which animals. It's not dose related. It can't really be predicted. So we are always watching the liver enzymes as well when we give these drugs. But this is less of an effect. It usually occurs, if it's going to, within a couple of weeks of constant administration. So we can usually pick up on it pretty readily and change drugs or do something different for the animal. All right, so I told you that if possible, we want to use these COX-2 selective inhibiting NSAIDs because it's going to help preserve gastric mucus production and bicarbonate production in the stomach and blood flow to the stomach. But the reality is that it's not quite that simple. With high doses of even the selective NSAIDs, we do get some of the COX-1 inhibiting effects as well. So I just wanted to make you aware of that. It's not so cut and dried, unfortunately. COX-1 and COX-2 probably have the opposite effect, some of that as well. So um, it was a good story when these drugs came out, but what we've learned since is that they aren't totally perfect in just affecting one area and not the other. So the other thing that I hope that you are I've made you aware of is that we do want to make sure when we give these drugs to tell owners to be sure to have um, water available to the animal at all times. So, what are NSAIDs? They are anti-inflammatories, but they also have a couple other properties. We've been talking about how they are analgesics as well, and then they also have antipyretic properties. And what that is the ability to reduce temperature in animals that are feverish. Fever does have a purpose. If an animal's body temperature raises a degree or two, it may be enough to inhibit the growth and proliferation of bacteria and viruses that are infecting the body. But it's usually a trade-off. We're usually trying to deal with some of that with antibiotics or antivirals and supporting the animal in other ways. And fever does make animals feel bad. They don't feel like eating. Sometimes they don't feel like drinking. So it is useful to reduce the fever, especially if it gets pretty high. So I've talked about how the kidney can be affected and how we do sometimes see some hepatotoxicity. And we are typically giving these drugs for arthritis control, pain control in these wonderful older animals. So our wonderful older Labrador retriever here with a white muzzle, these are our buddies, right? And we need to protect them. So what typically we do with them, and it's usually animals over about, dogs over about 7 years of age, cats kind of in the same area, maybe 9 or 10 years of age if we're going to give an NSAID, is, but we don't usually keep cats on this regimen for a long time. So we're really talking more about dogs. We will check their kidney and liver enzymes before we administer these drugs. And then we'll recheck again, maybe in a couple of weeks, because like I said, if that idiosyncratic hepatotoxicity shows up, it's going to show up in the first couple of weeks. But then we'll check them every 6 months because these are grandma and grandpa, and we want to make sure their health can progress poorly rapidly. So we want to make sure that we're keeping ahead of the game. So every 6 months, they typically come in and get blood work and get more of these drugs for the arthritis. In general, horses are very tolerant of NSAIDs, and we can give high dosages to them without seeing bad effects. Uh, Eventually, we do need to watch out for it, but that GI effect can happen in them as well as the kidney problems too. But then dogs are variably tolerant, so sometimes they are very much affected by these drugs and other times not. It happens with the type of drug and the dog. Cats are least tolerant, and if we give them, we're going to give them a dose every other day typically, or maybe a longer time frame because they are cats and they can't metabolize it as well. So, but we still will use them in cats. I also want to just back up and say that high liver enzymes, as long as we don't have any kidney problems, high liver enzymes in an older animal, as long as they're not dramatically increased, may not be a problem in starting the animals on these drugs. We just will want to watch them more carefully.